Good morning, everyone. Welcome to the Eastern Shore Delegation. Today is February 16th, 2024. I'd like to call the meeting to order. If we could rise for the same pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Delegate Hutchinson, would you be willing to offer prayer for us this morning?
I'd be happy to, Delegate Adams. Dear Lord, thank you for this wonderful day. Please guide us with grace and dignity as we represent the beautiful Eastern Shore. Watch over us as we work together to fight for our farmers, our watermen, our small business owners, our seniors, our veterans, and all the great people who call the Eastern Shore home. Most importantly, please provide us with the patience and wisdom to make a beautiful place to live even better. Amen.
Okay, good morning, everyone. First, I'd like to get approval of the meeting minutes. If I could get a motion and a second to approve the minutes.
Motion to approve.
Get a second?
Second.
Okay, all those in favor? Okay.
Aye.
Members, before we start with the Department of General Services, we need to take 2 minutes and have a treasurer's report. So, Delegate Hornberger, would you like to walk through that for about maybe a minute?
Very quickly, thank you, Mr. Chair. Over the last probably 10 years, we've had a collection of folks joining the bank account. And what we found due to recent rule changes at that bank branch was that the only way to add an individual on at this point was to have all of the previous individuals show up at one time at the bank based on their appointment schedule, which was nearly impossible. So we actually determined that the best way to do this was to withdraw the funds from the account and shutter the account and create a new one, which will have myself and Chair Adams on the account. And then we can add folks on as necessary in the future. So we've, thanks to Delegate Otto, who was one of the previous co-signers, he was able to withdraw those funds. We have a cashier's check. And in the next week or two, we were going to determine a local bank branch. Right now, I think M&T is probably going to be the favorite, which we will deposit that cashier's check, and that'll just help us with better continuity of our expenditures. So if anyone's got any objections to that or has got an alternative, either let myself or the chair know before we take action. But that's the only update at this time.
All right. So, Kevin, if there's any conversation about this, we'll hold that till the end. But I wanted to lay that out front and get that out of the way for sure.
Thank you, Mr. Chair.
So, members and also presenters, today we're getting closer to when session becomes a tight schedule. Most of our members, including myself, have voting at 10:30 today, and there's some committee work in the Senate. So we're going to have to move relatively quickly through the agenda. I just want to let you know that by 10:30 we should have to end the meeting. So we have the first presenter, Department of General Services. Secretary, good morning.
Good morning. Hopefully you can hear me okay.
Absolutely.
Okay, great. Good morning. I will try to share my screen here. And we will certainly provide this over to everyone as a presentation. Okay, can you all see my screen?
Yes.
Okay, great. So thank you very much. I want to really appreciate the delegation for providing the Department of General Services the opportunity to present, give us a quick overview. I'll try to, in the interest of time, try to be short. I'm a Chief Charter Secretary of the Department of General Services. And just wanted to provide a very quick overview and our impact on the Eastern Shore. We've got several divisions within the Department of General Services. I won't go through them by name here. I'll hit them through there. So we've got 7 different divisions that we have that handle various aspects relating to our operations. We are very, very much a support agency for state government, for the legislature, for judiciary, all branches of government. And I often call our team sort of the unsung heroes of state government. We're very, very much behind the scenes working to support everyone to make sure things are moving and that everyone is fully supportive, whether it's procurement or real estate or construction. So the Business Enterprise Administration has a capital grants unit. All legislative bond initiatives through the legislature are administered through the Office of Capital Grants here at the Department of General Services. We have inventory standards and support unit. We have an Office of Information Technology, and we've got a federal surplus program. I'll talk a little bit about some of these in particular. We got a federal surplus program where we are the conduit for the General Services Administration for the federal government. So any surplus equipment, furniture, etc., we are able to access as the conduit for the state. And a lot of times we're able to coordinate with the federal government on various aspects, laptops, food, equipment, other things from shuttered military bases. We're able to distribute over to nonprofits within or local entities, local governmental entities, other state aspects of state government. On the Eastern Shore, for fiscal year 23-24, we've had at least 3 we know where we've provided these types of federal surplus to different community organizations on the Eastern Shore. Our Office of Capital Grants, as I indicated, is where legislative bond initiatives and other capital grants from the legislature is administered. We're administering about 2,400 active grants right now, valued at about $1.7 billion. Eastern Shore has 135 active grants valued at over $36 million. I won't go in the interest of time into much detail here, but we do, and we'll provide this presentation so everyone has it. But we do hit the highlight here for each county, how many grants and the total dollar amount. So then that totals the 135 total grants and the $36 million. So everyone can be aware of within their respective county how many grants have been awarded and the total dollar value. The next unit we have within DGS is the Design, Construction, and Energy Unit, where we do, we are the only entity within state government, with the exception of MDOT, that has procurement authority for design, construction, and engineering services. So any agency that's doing a construction or renovation project, that is a DGS project being managed by Department of General Services. We also buy the state's energy and negotiate the state's energy, including the University System of Maryland. That gives the state a lot of leverage when it comes to buying power for all types of energy services. So when it comes to Eastern Shore projects, the projects we're doing on the Eastern Shore, about over $53 million worth of projects right now since 2016. We did a new National Guard armory, new construction, a Salisbury Animal Health Lab, Deerside Hospital Center. There was a mold remediation project there. Holly Center, we've done some many improvements here as well, and we've done definitely some improvements to the Eastern Shore Correctional Institute over for the Department of Public Safety and Correctional Services. So when it comes to active projects right now, the previous slide here was from 2016 till now, projects that are completed. Here are active projects right now. We've got 11 in design right now, totaling about $7 million, and 13 in construction, totaling nearly $93 million on the Eastern Shore. One of the big ones, which we did a groundbreaking last year, is State Police Barrack V in Berlin, $28 million project. Currently, I think we're well underway in construction, looking to be done hopefully late summer of this year. And we have another big project there at Eastern Shore, Eastern Correctional Institute. We've got a big infrastructure project there, totaling over $55 million, as well as a roof project. Office of External Affairs, we do a lot of communications. That is our conduit. It's where Government Affairs is, our compliance unit, any PIAs, our records management is there, and our communications office as well. Office of Facilities Management, this is where we manage our facilities. We've got 52 buildings under DGS's portfolio. So I want to clarify, our design and construction team supports 1,400 state facilities across the state. But our facilities team directly manages 52 buildings, which includes the State House, Government House, all the legislative buildings in Annapolis. On the Eastern Shore, well, it does also include, I do want to mention, 22 multi-service centers, which are typically the district courts for the counties. On the Eastern Shore, we've got 3 that we manage, Centerville, Denton, and Salisbury. We've got some more detail here on the age, square footage, the different tenants in the building, and the property as well. I won't go into much detail here, but we do manage the Centerville, the Denton, as well as the Salisbury district courts and multi-service centers. Maryland Capitol Police is a unit, full law enforcement agency within the Department of General Services. Their jurisdiction is within 1,000 feet of any state-owned or leased facility. This includes multi-service centers, that includes all state facilities that DGS manages, as well as any state facility as well. So even buildings or facilities that other state agencies own or manage, DGS still has jurisdiction there, being a state facility. And you see them here in Annapolis quite a bit, managing, taking care of safety and security for buildings. Office of State Procurement was developed in 2019, and it helps to manage all of centralized state procurement in one centralized location. Obviously there's a certain threshold for the Board of Public Works approval. Office of State Procurement then delegates procurement authority to state agencies that are under our purview, and we manage all procurement with the exception of the Maryland Department of Transportation. In 2023, calendar year 2023, Office of State Procurement awarded a total of 1,600 procurement contracts, and that totaled over $1 billion. And that is just Office of State Procurement contracts. We also oversee and have oversight over all contracts that other state agencies do that are above their delegation. So as an example, if an agency has only a delegation of $100,000, any contract above that, while the agency may conduct the procurement, DGS is the one that oversees it. Office of State Procurement will oversee that to make sure it's done appropriately because it's over their delegation. We've got several bureaus within that. We did bifurcate the office to have 2 deputy chief procurement officers. One will oversees all our actual procurement team and procurement staff. The other oversees all the support services, HR, our e-procurement platform, contract management, support, Board of Public Works, innovation, documentation, everything associated with procurement itself from a support perspective. So we got various aspects there within Office of State Procurement that they're managed here. Our Office of Real Estate, so we are the only entity in state government, with the exception of MDOT, that has real estate authority and procurement authority. We manage all leases, right-of-ways, the acquisition and purchase and disposal of real property, as well as we have an appraisal team as well. So any state agency that wants to buy or sell property, wants to either lease property that they own or lease commercial real estate for their own space, DGS Office of Real Estate would manage all that and handle all that on their behalf. We're currently we do agricultural easements as well. It's a big part of our portfolio. We're currently overseeing 100 agricultural easements as of 2023, valued at nearly $57 million. A third of these are located on the Eastern Shore. For our total number of leases on the Eastern Shore that we're currently managing is 102. And when it comes to both intergovernmental, meaning governmental entities we're leasing from or to, or commercial lease space, total is nearly 400,000 square feet. Some of our notable leases are the Upper Shore Community Mental Health Center, which is leased to Kent County for the Whitsitt Center, as well as various DHS, DSS sites for social services located, in various entities such as Cambridge, Easton, Centerville, Denton, and Princess Anne. We've got, and I don't want to hit too much on here, but we've got some additional lease management and procurement and lease construction currently underway. And what that means is a lot of times when we manage leases where we are helping if an agency lease commercial lease space, that space will be designed and custom built out to the agency's needs. So as that is under design and construction, the landlord will perform the work, and we amortize the cost of design and construction in our lease, which we negotiate on behalf of the agency, and DGS will oversee that design and construction and fit out to the agency's needs. Agricultural easements, I won't go into detail here. Nearly 5,600 acres, valued at nearly $21 million, that we manage and coordinate here. So with that, and again, I try to make it as succinct as possible in the interest of time. I'm happy to answer any questions that anyone may have.
Okay, Mr. Secretary, thank you very much. It looks like we have a couple questions. First, Hand us all was Delegate Jacobs.
Thank you, Mr. Chairman. So, Mr. Secretary, when you touched on the AF Whitsitt Center in Kent County, it kind of got my attention. I know last year we
Looks like Delegate Jacobs lost his Wi-Fi. Delegate Sample Hughes, why don't you go, and then we'll bring Jay back in.
Sure. Thank you, Mr. Chairman, and thank you, Mr. Secretary, for being here today. I appreciate the overview. If we make sure we get the slide presentation, then I can digest it a little bit more. First, I want to say thank you for your assistance with the veterans program here in Salisbury that has been thriving, and they needed that laptop support that you were able to give. My question is about the Deer's Head Hospital here in Wicomico County. Can you provide, and it could be certainly at another time, but what their structural needs are moving forward? Because I haven't heard anything lately regarding the status on their infrastructure or things that might need to be improved. If you could do that, that we greatly appreciate it, and just how much we may be looking forward to make those improvements.
No, thank you very much, Delegate Sample Hughes, for the question. Obviously, that's an MDH chronic care hospital, and we manage all the design, construction, facilities, and project management. Any issues that come up above their delegation. So happy to work with MDH to develop a list of all the deficiencies that we're aware of and sort of dollar amounts associated with those.
Oh, okay. I just thought that maybe you had a part of the process in some fashion, so you don't connect with. Go ahead. I'm sorry. Go ahead.
Yes, sorry. I give a quick overview. So yeah, so what ends up happening is we coordinate in these type of instances with the parent agency, which would be MDH, and we coordinate with them to identify their needs, right? And they're submitting what's called project justification forms, which document any issues that are maybe deficient in the facility. And then from there, those are brought into DGS in our building assessment unit. We manage those, and then we allocate funding associated with those. And all of those projects would be funded and managed through Department of General Services. So we do have a list of everything associated with that. Any of those deficiencies that are there or hanging out there, and the dollar amounts usually estimated associated with those. And we probably have a list as well. We definitely have a list that we can share with currently active projects for you as well. And we'll touch base with Maryland Department of Health, make sure there's nothing else out there that we are not aware of.
Okay, thank you. That's exactly what I was asking for, what you had in your purview. Thank you, Mr. Chair. Thank you, Mr. Secretary.
Delegate Jacobs, you're back. Let's try again.
All right, let's try again. Did everybody hear me? All right, I had to get my tin hat on and get the signal straight down here. And on the third floor, you got to watch this place. But anyhow, Mr. Secretary, thanks for being on there. When you touched on the AF Whitsitt Center, I know last year they took it off the divestiture list, and I think there was like $4 million in the budget for renovations, et cetera, HVAC improvements. Can you tell me where we are with that project?
Certainly, we can get you. I don't have the information at my fingertips, Delegate James. We can certainly get that information over to you where we are in the process, and get you a schedule associated with that as well.
Thank you very much.
Delegate Hornberger.
Thank you, Mr. Chair. And Mr. Secretary, that was a fantastic presentation. I really appreciate all the information. I just had a question building on my colleague, Sample Hughes. In terms of your purview, you had mentioned some of the district courthouses on the lower shore. Does your department do all district court buildings? Do they do circuit court as well? I know the third branch is always sort of different, but for example, Cecil County, do you do the district courts there?
Yeah.
So it's a great question, sir. Yes, so we manage all of most, I would say, most of the multi-service centers, so most of the district courts. So we coordinate very closely with Chief Judge Morrissey and the team for the district courts to help design and manage those buildings and construct those buildings, do any renovation associated with those. And that's where the sort of the delineation is. The district courts are managed by the state. The circuit courts are managed by the counties. So the counties
Right.
fund, build, construct, renovate, and maintain the circuit courts, while the state and Department of General Services manages the district courts.
Okay, yeah, and then my follow-on question to that is, some of us have aging court facilities, and we're looking at, but it's a big lift, right? So building a new circuit court is a massive undertaking, parking, all the associated. So do you offer assistance in terms of funding / guidance on construction if a county jurisdiction is wanting to, let's say, upgrade significantly or completely redo their circuit court?
No, it's a great question. So yeah, a couple things there. Typically, we have a building assessment unit with Department of General Services that goes around and does assessments of all 1,400 plus buildings. Every 2 years, they're assessed. And then we come up with, sort of deficiencies, any issues that need to be addressed, as well as if a full comprehensive renovation as well, sort of that's taken into totality of circumstances to determine when and how that comes to fruition. And usually we work with local jurisdiction on, is an expansion needed, a renovation needed, and we coordinate with that. So, and those projects are put in the capital budget for the Department of General Services. So we manage those projects, so design and construction projects, as DGS projects, being a multi-service center under our portfolio.
Okay, great, thanks.
Okay, last question, Senator Mounts.
Thank you, Mr. Secretary. Who's the contact in the department for that surplus laptop program? Hey, Secretary, good morning. How you doing?
Morning, Senator.
Who is there a contact for the surplus properties specifically with regards to laptops?
Yes, sir. We'll send you over a contact of our point of contact for our federal surplus program, so you can coordinate with them on what's available and what we have coming in the queue. I will say that it's sort of hit or miss depending on what's available from the federal government. We always have a very keen eye out to look out for laptops, other types of equipment that are available. But we'll certainly connect you with that. So anything you might need or your constituents might need, we can help facilitate.
Yeah, the furniture, surplus furniture, and the laptops were always very popular. The furniture, especially for shelters and things like that.
Absolutely. Yeah, it's a great conduit. It comes at little to no cost. And it's a great opportunity for us to leverage that for many of our underserved areas.
Or if they could just email the office and then I'll give them my cell phone, be great. Thank you.
Absolutely. Happy to do it, sir.
Okay, thank you, Mr. Secretary, for being with us. And let me just say, it's nice to have you with us today. We've had almost all the departments come through over a 2-year period, and really appreciate the administration's willingness to share with us. We learn something new every time we have folks like you come on, and we appreciate your time today. Okay,
Thanks,
next
sir.
up, you're very welcome. You're very welcome.
We're happy to serve, and if you need us, please feel free to chat anytime.
Sounds good.
Thank you.
All right, next up is Chop Tank Electric. Good morning.
Good morning. Let me pull my screen up here for you.
Val, I'll just mention in case you weren't on before, we have some hearings and vote sessions at 10:30 today for almost all the members, and just keep that in mind as we're trying to go through.
Right. Yeah, we're going to try and run through it really quickly. It's just, we thank you again for allowing us to give you a quick update on what we're doing here at Chop Tank. I'm Valerie Conley, Vice President of Government Affairs and Public Relations for Chop Tank Electric Cooperative. With me today is Matt Tiffel. He's the Manager of Government Affairs and Economic Development. I also wanted to remind the delegation that Chop Tank is represented in Annapolis by Cornerstone Government Affairs, specifically Tiffany Harvey, Bernie Marzik, and Delora Ifakache. I'm going to give you just a brief update on electric and broadband data, and then Matt will go over our priority legislation and our recent work in the community. For over 80 years, Chop Tank has been providing the Eastern Shore with reliable, affordable electric service. We are member-owned by the 56,000 customers that we serve in the 9 counties on Maryland's Eastern Shore. This slide has a few of our stats from the most recent year-end report. We have a 99% reliability rating, and the average number of outages per member was under 2. Our call center, which is staffed in both of our Denton and our Salisbury offices, handled almost 55,000 calls last year. Our 158 full-time employees maintain over 6,000 miles of electric distribution lines. And we have 1,395 net metered customers. These are members who have installed rooftop solar systems. This year, I wanted to just give you guys an update or take a moment to mention our advanced outage reporting system and our online outage map. To view it, members can go to the Choptank Electric homepage and then navigate either to our resource tab or go to the bottom banner and click on the outage map. You can see all the current outages and a breakdown of how many locations are impacted in each county. On this slide, you can see the truck in Cecil County, and the grid shows 3 members are impacted. I pulled this picture a couple of weeks ago, so this is not a current outage. But you can also get the outage reporting number on this page. And our advanced metering system usually lets us know right away if electric service is down, but for peace of mind, members can call the outage number, they can text an outage, or they can use the Smart Hub app to just ping us about it. If you click on the dot where the truck is on the website, you can see specific details about the outage, including how many locations on each road are impacted. We update the computer system in a regular interval as we get information from our linemen who are actively investigating and putting together a restoration plan. Our communications team works to keep members up to date on our Facebook page during an outage. The cooperative spirit is always evident when we read the comments from our members, who are mostly appreciative of the work that's being done, and they always thank our team and urge our linemen to stay safe out there during weather events. This slide has some of the comments from members during that storm that took place in early January. Next, I just wanted to mention our newest endeavor, which is a power line worker pre-apprenticeship program. The inaugural class graduated from Warwick College in this program on December 20th. 7 young men interested in entering apprenticeship programs with Choptank or other utility companies or contractors on the shore completed a 13-week program administered by Warwick, but then conducted at the Choptank Training Yard in Salisbury. Graduates will complete their CDL qualifications and be ready to work in the local community in apprenticeship jobs very soon. The first 5 cohorts of this program, which will each have 7 to 10 students, is completely grant funded through scholarships from the U.S. and the Maryland Departments of Labor. The 13-week training program, followed by the CDL certification, will occur in back-to-back sessions through September of 2025. Interested students can apply online at easternshorejobs.com/career training programs. Local workforce development is a priority for Choptank, and the Powerline Worker Pre-Apprenticeship Program allows us to fulfill that program. Allows us to fulfill that commitment. Creating this opportunity came from a partnership between Choptank Electric Cooperative, Warwick College, and the Virginia, Maryland, Delaware Association of Electric Cooperatives. We wanted to bring training closer to home for the young men and hopefully some women who want a fulfilling career with good paying jobs here on the Eastern Shore. And then Choptank Fiber. This is one of our most exciting services to member. First, I want to thank all of you on the Eastern Shore delegation for helping to make this possible. Your work in 2020 and your support for our grant applications has allowed us to achieve monumental success in bringing broadband internet to the unserved on the Eastern Shore. To date, we've passed over 10,000 locations. This map kind of shows our construction footprint on the Eastern Shore. Currently, we're working to complete grant projects, which have been funded by state and local governments and has some significant match funding from Choptank Fiber. We continue to urge residents to visit our Choptank Fiber website to register their interest, to explore our offerings, and to help us identify the remaining unserved locations. The next grant opportunity will come through the federal BEAD program, The Office of Statewide Broadband is expected to put this application out in the fall, and it will include blocks of unserved locations that are being put out for bid. So we're now working with local governments to make sure that these maps correctly reflect all of the residential locations and business locations that lack broadband internet, so they can be eligible for funding during this. I'm going to now pass the program on to Matt, who has a couple of updates for you on the next slides.
Thank you, Val, and good morning, Mr. Chairman and delegation. Great seeing you all. I'm going to be very quick. We have one piece of legislation that we put forward this year, and that's SB 510 and House Bill 487. And what it does is it establishes a definition for non-escheat capital credits in the state code. What this bill does, it allows electric cooperatives to use unclaimed capital credits to benefit the members of the cooperative, rather to remit them back to the state as abandoned property. As you all know, we've been part of the community for 85 years. We have a long-standing record of investing and donating with many various organizations on the Eastern Shore. Next slide, please. In doing so, we have a really great opportunity to educate our members of what capital credits are. As many of you know, cooperatives are different than investor-owned utilities. When we make margins on the distribution of energy every year, we retire those margins into capital credits and then over time release them to our members. And this is a good post that we've done on social media, our magazine, Cooperative Living, that goes out to all 56,000 members monthly. So we're educating our members to let them know that this is a benefit of being a member of the cooperative. So I wanted to share that slide just as the four-step kind of educational part of that going into this piece of legislation. Next slide. The bill also aligns the electric co-ops in Maryland with 37 other states, including Delaware, which passed this piece of legislation in 1998 and have been very successful in various ways of utilizing these funds within the community. Here you have a quick list of what examples that we've identified the funds could be used for. And I'll end on this note for the legislation that I want to thank you, Mr. Chairman, and Senator Hershey for being the sponsors of the bills, but also the entire Eastern Shore delegation for supporting them as well as co-sponsors. We are currently had our bill hearing in the Senate yesterday in the Judicial Proceedings Committee. I think it went very well. So, and we also had last week our bill hearing in the Economic Matters Committee on the House. So we will be working to try and get the bills out of the committee over the next few weeks before crossover date. I'll go to the next slide. And as you saw, one of those examples was giving back, and Val mentioned the workforce development piece of it as well. We have a big, strong commitment giving back to the community. And one of the projects I just want to highlight very quickly is our partnership with Delmarva Power for the Junior Achievement Purdue Henson Achievement Center in Salisbury. Next slide, please. As you can see here, here's our, we partner with Delmarva Power, and I think Renee's on the call here. It's a great opportunity. 10,000 students are going to come to the center. If you haven't been there, I really encourage you to visit it sometime. But what our storefront does, it focuses on the energy industry, and it touches things from career engagement, STEM programming, and workforce development. It's a hands-on, unique storefront where students are going to engage of what they could be. Oh, sorry, next slide. What they can do, whether the careers as a line worker, engineer, community rep, CEO and CFO. And the great piece of this storefront is the 12-foot mural on the back wall of how energy gets to you, or how our energy grid works. And it goes from generation all the way to the substation to your home. It's real detailed. I think it's a really, really awesome piece of the storefront. So again, that's part of our commitment to community. This is a 3-year, $50,000 investment that we've committed to JA. And I just really encourage the members and those on the call to visit it if you can. Next slide. This is a slide we've included over the last few years, and as many know, Chop Tank Electric Cooperative, we receive 100% of our wholesale power from Old Dominion Electric Cooperative, ODEC. They have a facility in Maryland, the Wildcat Point Generation Facility in Cecil County. It's reliable natural gas-based generation, and it can, provide up to 1,000 megawatt of clean and reliable power to the citizens of both Maryland, Virginia, and Delaware. ODEC does have a goal of being net zero carbon dioxide emissions by 2050. And recently, just this past week, they hired a new CEO, and I will send out that press release to the delegation following this presentation. With that, I think the next slide. Just here's some photos of us in the community giving back. Down the left-hand side is our recent announcement of $2.5 million in capital credits back to our members, and various other events and things that we are part of. I'll hand it back over to Val if you have any more comments, and we're here for questions.
So that's all we have this morning for you, Mr. Chairman, and unless you have something else you need to know from us.
Okay, let's see if we have any questions from the members. Delegate Hornberger?
Yeah, just more of a comment, and this goes to Mr. Defoe's presentation. Educating the public on how the power gets to them is so paramount in this day and age, especially when we're dealing with these major weather events and the like. Folks, hit that swish and the light comes on in their home, and that's really the extent that they think about how electricity gets distributed. So I just wanted to applaud you for the education efforts of the general public to show that it's actually an incredibly complicated process and all the work that goes on behind the scenes to get them that reliable power. So thank you.
Thank you.
Absolutely. Well, Val and Matt, it doesn't look like we have any questions. Thank you for the update. And as always, keep us up to speed with broadband. That's all very important, and we appreciate your leadership in helping go that last mile. So thank you.
Excellent. Thank you.
Thank you.
All right, bye-bye. Okay, next up, we have Christiana. Good morning.
Good morning. Thank you so much for having me. I'm just sharing my presentation. There we go. Hopefully you can see my screen and my slides. Good morning. Thank you so much again for having me. My name is Sarah Stowens. I am the manager of state policy and advocacy at Christiana Care. I manage the portfolios in Maryland and Delaware, and have been working in Delaware for about a year now. In Maryland for about a year now. We are represented in Annapolis by CDI Consulting. Krista Picho and Keith Walmsley have been extremely helpful in teaching me a little bit about Annapolis and what's going on down there. But excited to be here and to talk with you and share a little bit about Union Hospital. Want to make sure that I've started there. Let you know that Union Hospital, for most of you who probably already know this, we're with Union long before Christiana. We were established in 1908 and have been providing that high quality care that people have come to expect from Union Hospital in Cecil County for over 113 years. Christiana Care joined the Union family, and Union joined ours in 2020, January of 2020. And we are in Delaware, both the largest healthcare system and the largest private employer. So as we have been learning about Cecil County and becoming part of Cecil County, it's been a fantastic opportunity to build relationships and learn about what we can take from Maryland and implement into Delaware and bring from Delaware into our Maryland family. So a little bit by the numbers, who we are. So just giving you this high view of Union Hospital. We have 108 licensed beds and 6 operating rooms. And I like to point out, this is our front door right here. If you haven't seen us, or if you haven't been to visit us in a non-patient capacity, I hope that you'll let me know and you can come and we can do a tour and you can see our new family birth center. We have a lot to show off and a lot to offer. So excited about that. We do have 360 physicians who work for us and just over 1,300 caregivers total. These numbers in the middle give you a little bit of a highlight about what we're doing for and with and in the community every year. So all of these numbers are from fiscal year 23. You'll see that in fiscal year 23, we had just over 6,000 admissions to the hospital. That's across the board, all of our services. We had 384 births in our hospital at Union. 4,164 surgical procedures. If anybody's interested in me breaking down those numbers, I certainly can, but the surgical procedures are kind of across the surgical spectrum that we would generally look at. And then the number that I am particularly taken aback by is our emergency department visits. We had in FY23 35,000, just over 35,000 emergency department visits. When I think about the Cecil County community, and when I think about just quite frankly the population in Cecil County, that 35,000 emergency department visits really solidifies the kind of need there is and the kind of work that we have to do to ensure that those 35,000 folks were seen well, they were seen promptly, they were given good service and good care. And that is what I know that the community counts on us for, and that is what we hold ourselves to. Just to highlight that our key services that we kind of highlight and talk about in the community are certainly that emergency department, our intensive care unit, behavioral health services, which we are continuing to build out, but have done a little building out of since we took over in 2020 as well. Our cancer care and wound care have been particular interests in conversations we've had with some of our stakeholder partners. We do a lot of diabetes and heart care, breast health, and the Family Birth Center, that women's health care has been really important to the community. And then we also do a lot of health education. I know that a lot of folks in the community already know and love Lisa Fields, but Lisa is one of our amazing ambassadors, and she does a lot of community health education and a lot of work with our stakeholder partners. So always here to shout out Lisa Fields and all the good work she's doing as well. Just a high level view again of the work that we're doing with respect to giving back to the community. Just under $2 million in charity care. Again, all of these numbers are from FY23. And $35,000 to community health improvement services. We've given $139,000 to community benefit contributions. Those are, the sponsorships we provide, the scholarships, the workforce programs, that kind of thing. And then $224,000 to health professions education. And then our research arm is a bit smaller in Maryland than it is in Delaware, but we are looking to expand that as well. And our research community benefit dollars in FY23 were just 13,700. So those are our community benefit dollars, but I would be remiss if I didn't highlight also some of the programs that are not necessarily captured by these numbers. Programs like our peer recovery program, which many of you potentially know about. We've partnered with Voices of Hope and have round the clock services for SUD patients who need support in potentially an additional way, right? Our providers are giving them that medical attention, that medical care that they need, but our peer recovery program offers them the wraparound services, the connections to the community, the additional support that they need. We do have and are expanding a partnership with Round Trip, specifically with our primary care offices right now. Round Trip our goal with Round Trip is to break down those barriers to care that we see from our patients. We are doing some social drivers of health data collection, and Union has been fantastic at those social drivers of health data collection surveys. We see a lot that our patients have not only food insecurity, but they have also some financial barriers. And one of the things that prevents them from doing is just simply getting to their primary care appointments. So our round trip services offer those patients at no cost to them rides to their primary care appointments and then home again. And then finally, our Dispensary of Hope program is just starting. So the next time I come and brief you, I will look forward to that, but I will hopefully have some better numbers for you on what the Dispensary of Hope program has been able to offer our community. The Dispensary of Hope program, though, is a low cost or no cost pharmacy program where we're able to not only offer our patients their prescription drugs at low or no cost, but also break through a number of barriers and offer them those prescriptions at time of appointment instead of having to go to another place to receive their prescription at another time. So we're hoping that also continues to streamline their experience and offer them the excellent care we expect of ourselves, and we know you expect of us as well. So quickly, I know that you're on a time crunch, but I did want to highlight a few of our priorities in Annapolis. So these are kind of our three umbrella priorities that we're focused on as we look through this session in Annapolis. We are very committed, of course, to strengthening Maryland's healthcare workforce. Two programs in particular are the programs that we are focused on for this session. Maryland's Pathways to Nursing program, which is HB 354. We're working with Cecil College on supporting that program. The House bill would offer a pilot program for community college, and the language in the bill talks about regionally diverse community colleges. So we're very hopeful that would come to Cecil. We're also supporting HB 425, which is the APRN Compact. For those who aren't as familiar with the APRN Compact would allow for APRNs, to opt into the APRN license, and then once 7 states have passed it, operate in any of those compact states. Delaware has already passed the APRN Compact, so we are in a fantastic situation to really utilize that compact as soon as the 7th state has passed it. So really looking forward to that and hopeful that will pass. Of course, we are aware and focused on the throughput issue with respect to access to care, but also the hospital throughput for all Marylanders, but Cecil County specifically. So we've been focused on I'm sorry, just lost my train of thought right in the middle. We've been really working with MHA to ensure that we have all of our, we have a seat at the table and in all of our conversations about ED wait times. There was just a presentation to the HSCRC. I know that there are some bills that have come out. We're reviewing those with MHA. So, we're making sure that not only are we focused on that in Annapolis, but we're also focused on it in our own system and what that looks like in improving door-to-doctor wait times in the emergency room, but also making sure that the entire experience, should those patients be admitted, is one that, Marylanders can expect excellence from us. And then our third priority in Annapolis is hospital and health system sustainability. And we're really looking at not only maintaining the hospital bond financing or capital program, but also looking at the reduction of Medicaid debt and what that might look like over the next fiscal years. And then I know I've had a conversation with a couple of you about this, but as a small rural hospital, one of the things that has been of particular consternation to us in ongoing fashion is the Maryland model and how it impacts those beds that we have and how it impacts the ultimate quality care that we provide to our patients. So that is I wanted to give you a highlight, but I also wanted to run through it quickly. So I'm happy to stop sharing and answer questions. I'm also happy to dive into any of the presentation that might be of interest to anyone.
Okay, Sarah, thank you much for giving us your update and presentation. Healthcare is one of the very top issues, as you know, on the rural Eastern Shore, and you summed it up pretty succinctly there at the end. And we appreciate all that you are doing and giving us your particular update in your area. We do have a couple of questions. Delegate Sample Hughes.
Thank you. And Sarah, thank you so much for your presentation today. And thank you for being here, giving us a better insight. I wanted to just ask you a quick question as it relates to the emergency room wait times. I know you said you took care of about 35,000 persons. And in Maryland, we are trying to do our best towards reducing the wait time, because I think we were one of the highest wait time states in the nation. With that being said, that was as a result, or many things, but one of them in particular was behavioral health, the lack of behavioral health services that we have in Maryland. So if you could just tell me what your average wait time is and what resources you have for the behavioral health piece.
So I can tell you the average wait time, but it's going to factor in our Delaware campuses. So I'm going to promise that I'm going to get you the union wait time by the end of the day. But I unfortunately don't have the number in front of me broken out. So I'm going to promise that I get that to Delegate Adams and to send out to the delegation.
Sure.
I think ultimately what we are seeing in our union emergency department specifically is two things. One, the need for the behavioral health expanded services, but then additionally, the Family Birth Center has actually offloaded a sizable amount of our patients who are coming to us with specific needs around pregnancy, around, so we're able to shift and follow our model from our Newark campus, which has OB triage that's separate from our general emergency department. So we've been able to shift some of the need to our different service lines, and that has eased the strain. I'm not sure that it's fixed the problem at Union, just like it hasn't fixed the problem statewide, but we are working on it. I will also say programs like Round Trip that are easing the barriers that patients are telling us they have to get to those primary care appointments is demonstrating a lower acuity in the emergency department. We're seeing fewer they were called MVPs in the HSCRC presentation earlier this week. We're seeing fewer of those in the emergency department because of the prevention, right? Because of that primary care. And so we know the primary care works. We know that preventative medicine works. And we really are trying to ensure that we are offering both the emergent and the prevention care appropriately.
Okay, thank you very much.
And I will get you that data by the end of the day, I promise.
Okay.
Thank you.
Delegate Hornberger.
Thank you, Ms. Chair. And Sarah, thank you for taking the time to meet with me earlier in the session.
Yeah.
I spoke briefly about, when the union acquisition took place, we were slated to get a mental health triage facility there in Elkton. Unfortunately, that project did not come to fruition, COVID related, funding related. So the property was acquisitioned, even though the groundbreaking never occurred. Could you just give us an update on any future plans for that parcel? Are we going to look at getting those beds in for the rapid care and the mental health? Because we think that would go a long way. Obviously, the funding being what it is, we want to try any way that we can to get it moving.
Yeah, absolutely. And I honestly don't remember if I shared this with you at the time. So if I didn't, I apologize. But Union has partnered with Shepherd Pratt to create not only a plan for that particular project, but comprehensively for our behavioral health strategy moving forward for the next 5 years. So the strategic plan and the ultimate project is proposed to come to us on May 1st. So I will have a better sense of what that project and what that plan looks like. I asked that we kind of move up the deadline as far as we can, because I know you all need the time to talk about bond financing. I want to make sure that we're being good partners and we're, giving you all the information you need to be good partners in Annapolis as well. But really, when we're looking not only at the specific project with respect to the rapid beds, but also, holistically, how can we holistically support Cecil County's behavioral health needs? That's really what we're trying to accomplish with that partnership. So I would love to be invited back and give you an update on the proposed plan once we have that. And I would also love to bring Erin Booker, who is our Chief Biopsychosocial Officer, which is a mouthful, and I practice saying it all the time. She is in charge of that plan, in charge of implementing that. So I would love to bring her as well, so she can give you some more specific insights into that project.
Great, thanks so much.
Yeah, absolutely.
Okay, no further questions. Sarah, thank you again for coming in, and we appreciate the update and the information.
Thank you all so much for having me. Bye.
Okay, next up is University of Maryland, Baltimore. Is Mark Gladwin there? There we go.
Yes, I'm here. Thank you and good afternoon. My name is Mark Gladwin. I'm the new dean of the School of Medicine at the University of Maryland, Baltimore. We're the School of Medicine that serves all the University of Maryland medicine system. And it's really an honor to be able to meet you all. President Gerald had to present to the Board of Regents today, so I'm covering for him. And I know many of the topics I'll bring up, you all know a lot more about than I do, but I thought I could sort of provide an overview of where we are with a number of very exciting, I think, transformative projects where the School of Medicine and the faculty practices are partnering to bring better care to the shore. So it's okay, I'll start and kind of go through a summary of an update of all the projects and then take questions.
Yes.
You can hear me okay?
I can hear you fine, absolutely.
Thank you. So as you all know, compared to Baltimore City, rural counties have the largest proportion of their population, 76%, that are living in medically underserved areas. And Calvert, Caroline, Garrett, Kent, Somerset, Worcester counties each have 100% of their populations living in medically underserved area designated regions. 24,000 Eastern Shore residents do not have health insurance. All 5 of Maryland's counties with the fewest primary care physicians per capita are on the Eastern Shore. 2 of 5 Maryland counties with the fewest mental health providers are on the Eastern Shore. And 1 in 4 Eastern Shore residents are living at least 10 miles from a hospital. So clearly, as we all know, there is a pressing need to enhance physician and medical provider services and hospital services for the Eastern Shore. So the University of Maryland, Baltimore and the School of Medicine has had a long relationship with healthcare and training for the Eastern Shore. So more than 25 years ago, the School of Medicine, along with Maryland Department of Health, acquired HRSA funds to establish the Maryland Health Education Resource Centers. And these are located in Cambridge and bring UMB medical, dental, pharmacy, social work, nursing students to the shore for educational experiences and healthcare education for patients, and creates a pipeline to attract people to careers at the Eastern Shore. The family medicine department within our faculty traditionally has worked in collaboration to oversee these AHECs. We've also significantly expanded our faculty primary care and specialists through Senate Bill 433. So we have now gynecologic oncology providers on the Eastern Shore, pediatric hospitalists. We're providing telemedicine, neurology, and dermatology, radiation oncology faculty, radiology services, family medicine, plastic surgery, and recently maternal fetal health. That SB 433 provides $2 million per year for 3 years and would need renewal to set for a new hospital there. The University of Maryland Medical System and faculty are absolutely committed to expanding healthcare with a new hospital, a new family medicine residency, and I'll share with you a major plan for our medical school expansion. So I'd like to quickly just go through updates on the hospital, updates about the residency, and then talk about this new medical expansion opportunity. So the hospital, led by the Shore delegation, has included $10 million in the FY24 capital budget for planning. The governor included $20 million in funding for the project in the FY25 capital budget and $70 million over the next 3 fiscal years. The Shore Certificate of Need application has been approved on January 18th. And the last piece of the puzzle now is to obtain rate commission approval for rate application to the hospital. Our hospital has covered transitional funding for this, and that discussion and negotiation with the rate commission is in process, and there's a vote at the April 10th meeting. So of course, that becomes a very important piece to this puzzle. We also are, of course, going to need to build physician services to support patients in the Eastern Shore, but also ultimately to staff the hospital. And so we are building a family medicine residency on the Eastern Shore. So there was $1.5 million that you all secured to support the building of this. We've obtained our certificate of need. We are planning for rotations at Shore Regional in partnership with Ken Kozar and Dr. Huffner with UMMS. We're also partnering with the Chop Tank FQHC in the upper mid-shore and lower part of the Eastern Shore. Our hospital has agreed to bridge support the program while we're seeking permanent funds from the Rate Commission. So again, we'll need advocacy with the Rate Commission to support that residency. Residency slots are funded through CMS, which in the state of Maryland runs through Rate Commission and the GBR. And then those residents work for their advanced training, typically about 3 years after med school, and then they become independent physicians. The last piece I want to update with is an entirely new program. We're very excited about it. We'll really need your support for that. And that is that we're creating a new program called RHEAL, which is Rural Health, Equity and Access Longitudinal Elective. This is a partnership with our president, Bruce Jarrell, with the president of University of Maryland Eastern Shore, Heidi Anderson, and our dean of the medical school, Donna Parker, is partnering with Sean Vasitas, who's the dean of the School of Pharmacy at the University of Maryland Eastern Shore. We've all invested $300,000 between the 3 partners to start the program. We've hired a director, an assistant director, admin support to begin the planning and to actually have this program start. And we put in a federal grant for the program, and we think it would be very helpful to get state support for this. But what this is our medical school. So we're the only MD granting medical school in the state, the only medical school in the state currently. We have 150 students per year. So over 4 years of medical school, that ends up being 600 medical students. Every year now, we have 6,500 applicants to our medical school. And the students are incredibly elite that are now applying to the medical school. As an example, there's 600 students in this applicant pool that have a GPA approaching 4.0 and a 99 percentile in their MCAT, just to show how competitive med school is today. So we've moved forward since I become dean to begin the process of expanding the med school. And so we're going to go this admission year, which is in process right now, up to 165. And we're going to create this rural health equity track. And what will happen in this track is the students will spend most of their time in the first 2 years in Baltimore so that we don't need approval from our accreditation committee. We're allowed to do that, but they will do rotations on the Eastern Shore. And then in the last 2 years of medical school, they will spend 4 months each year on the Eastern Shore. We have housing there. We'll have education and training there. And what we're seeking is scholarship support, and that we would tie these scholarships to repayment by then being a physician on the Eastern Shore. We think if we could get, for example, full scholarships for this, that people nationally and regionally would compete to get into this track, and the best and brightest would be attracted through our med school to serve on the Eastern Shore. The cost of this, it's about, in steady state, about $800,000 to be able to have the teachers and the trainers on the Eastern Shore, as well as to build the med school in Baltimore. And then it's a $42,000 tuition per year. So as we scale with 10 in year 1, 20 in year 2, up to 40 students in year 4, full scholarships would be about 1.6 million per year. And again, we would have the top students in the world applying for this program with a full scholarship to serve in the Eastern Shore. We think there's a lot of interest in our students in rural healthcare, in health equity, and we think this could be a signature program to attract future doctors. So that's what we've been looking for, with would be about 2.2 million per year to drive this program, and then build as the hospital builds and our programs build there. So I'll stop there and see if there's any questions. I know that's a lot of information, but a lot of exciting things are happening around the hospital, around the family medicine residency, and around our expansion of the med school to serve our rural communities.
Okay, well, Dr. Gladwin, that is absolutely a lot of good information, and we're very enthusiastic. Obviously, the governor's budget puts you in a good posture, and frankly, the Eastern Shore in a good posture. I like to see that kind of support. It speaks to momentum not only for you, but for all of our systems as we try to improve. And frankly, the education and the residency component is surely needed, and we appreciate that. So members, do we have any questions for University of Maryland, Baltimore? Okay, seeing none, thank you for coming in today and giving us an update.
Thank you so much, and I look forward to meeting all of you in the future. And thanks for your leadership, your support, and we'll continue to build a vibrant healthcare community together with you moving forward. Thank you.
Absolutely. Okay, next up is Choptank Community Health System, Sarah Rich. And Sarah, good morning. I'm happy to report that we've got some time on the clock here. We're getting late in session, so I've got to start shortening the agenda. Delegate Hornberger gave me a suggestion today that I needed to make sure we don't go over, but we appreciate the fact that you're here, and I think we have probably about 20 minutes before we'll have to sign off. So the floor is yours.
Well, great. Thank you so much, Chair Adams. And I'm so excited to be with you this morning. I'm Sarah Rich. I'm the CEO here at Choptank Community Health. And I don't think I'll take the full 20 minutes, but we'll go ahead and get started. So I think everybody's aware that Choptank Community Health provides medical, dental, and behavioral health services. We take care of about 30,000 adults and children across Caroline, Dorchester, Kent, Queen Anne's, and Talbot counties. We have 7 health centers, 18 school-based health centers, and we also do multiple outreach efforts. And we've been at this for more than 40 years. And I always like to start with our mission, why we're here. It helps inform our decisions. It's really our roadmap in terms of where we're going. So our mission is to provide access. That's a key word for us. We want access to care for the residents of the shore here. And that care should be exceptional, comprehensive, and integrated for everybody. And again, that's something that we live every single day. So I'm just going to give you an update on some of the exciting things that are happening here at Choptank that are focused on providing that access to care for communities on the shore. So I'm going to try to be really savvy here with my technology and just share a couple pictures about some of the things that we are up to. Oh, now I've lost you all. Hold on here.
We see it fine here.
You can see it? Fantastic. Okay, I can't see all of you, but that's okay. So in early summer of 2023, we broke ground on our new Fedelsburg Health Center. This health center is 21,000 square feet, and it's going to replace our current facility that is 7,400 square feet. So it is going to be a much bigger health center to provide access to care. So we will have 5 dedicated wings for medical, dental, and behavioral health services. We also are going to be housing the rural residency program that Dean Gladwin had mentioned in his remarks. We are part of that partnership with University of Maryland School of Medicine and Shore Regional Health. So we're very excited to bring those residents to our community health center and continue to expand upon the access to care that we provide at Choptank Community Health. We also will house our dental residency program in this location, and we are currently in the development of a pediatric dental residency program, and that is in partnership with NYU Langone. So in terms of Federalsburg, we have been providing care there since 1992, and we see more than 5,000 patients in that facility. So you can see in the pictures there, it's starting to look like a building, which is a wonderful sign. We've had a lot of rain. You can see some of the mud there, so that does impact our schedule a bit, but it is moving along very well. All right, let me flip to the next screen here. And we did announce in April of 2021 that we were expanding up into Kent County. And we are very excited about what we've been doing up there. We started providing medical services, primary health care, women's health, pediatrics, behavioral health, and chronic care management in Chestertown. We are currently renovating our building there on Philosopher's Terrace. And when that new site is complete, we will have expanded space for medical, for behavioral health. We'll have lab services. And I'm really excited about bringing dental care to Kent County and to Chestertown. So that is on the horizon. We've also opened in Rock Hall our first school-based health center in Kent County. And here's some pictures of that site. We've just done some renovations there. But what's neat about this location is that Rock Hall School-Based Health Center is open to the community. So if I'm a resident in Rock Hall and I need care, I can go right to the school if I'm not able to make it into Chestertown. So certainly part of that mission in terms of access is to break down barriers. And so having health centers located where people need it make a lot of sense for us. So we're excited about that. And then continuing the theme of access, we now have 3 mobile health units that are out on the road. Maybe you've seen some of these in the various communities, but we're taking those to provide that access to some of the underserved residents in the communities we serve. So Kent County, we are now providing medical and behavioral health services in Millington and Galena. We're working with some of the other municipalities in Kent County to expand access and build that schedule. Our second mobile health unit is working to provide school-based dental services. We're using that in Dorchester and Talbot counties. And then our third mobile health unit, we're really starting some new outreach with partnerships with His Hope Haven, Talbot Interface Services, so we can bring medical and then eventually, excuse me, dental and behavioral health services to the homeless populations. And we're working on that in Caroline and Talbot counties. I also wanted to mention that in the last year, and I think that's the last of my slides, so I can stop sharing. We have expanded our behavioral health into schools as well. We know that is a huge need. So we do have therapists now in Caroline and Talbot counties. We just learned that we got a grant from the Maryland Community Health Resource Commission to add behavioral health services in schools in Kent and Queen Anne's County as well. So we're very, very excited about that. We did expand our office in Easton. We had a pediatric practice there, and now we're doing primary care as well and women's health. And then just in terms of celebration milestones, this past year, we celebrated 20 years of providing care in Bay 100 down in St. Michael's, our St. Michael's office, 25 years in Dorchester County at our Fassett McGee location. And then this year, we're celebrating 25 years of providing school-based health services. So we're very excited about our continued focus on mission and that access to care, which is so important. So I'm really thankful for all of your support, for your interest in what we do here at Choptank. And certainly, if anyone is interested in coming to visit one of our health centers, we would love to have you. So that is the wrap up of what I wanted to share in terms of updates.
Choptank is growing. That is the sum up there. Delegate Hutchinson.
Thank you, Chair. Great to see you guys today, and I'm also
Morning.
just so impressed to see what Choptank Community Health is doing for us on the shore. I love the mobile units. That's awesome. I'll give you a shout out to Hannah Salisbury and Dr. Alalaki.
Yes.
Great job testifying in my committee on House Bill 393 this past week. So you got a good team out there fighting for dentistry on the shore. So I got to ask the question though, any thoughts about your expansion or new location in Dorchester County?
Well, it's always on my mind, Delegate Hutchinson. Certainly we have a lot on our plate right now with the Fedelsburg construction and the Chestertown renovations, but there is more we can do in Dorchester County. We'd like to do more. And so we want to continue to explore what that could look like in the future with Chop Tank.
I'll continue
Thank
to
you.
keep my eye out for you too, okay?
I appreciate that.
Okay, Sarah, I'm not seeing any other questions.
Okay.
So thank you for the update today. And again, I say this to all of our healthcare partners. You are, if not the most top concern and care for us as the Eastern Shore delegation, certainly one of, and we appreciate the momentum that we've heard today from our partners from Cecil County and right here in the Midshore. So thank you for everything that you do.
Thank you so much.
Okay, members, let's do a quick round with federal updates. I see Kim Cradaville. Hi, Kim.
Good morning. Thank you. Always love hearing things that are going on the shore. Thank you. Real quick, last week we had a great visit with the senator, had a quick, very fast opportunity, 2-day turnaround to plan the day for him. And he had the opportunity to see Teddy Bear Fresh and some of the federal funds that came in there. We also went to Chesapeake College, with the updated farm bill coming, had a great conversation with some aquaculture, agriculture, and soil conservation folks. A lot of follow-up from that. And then we had a lunch with some of the Black watermen who were highlighted on that Maryland Public Television piece documentary that they did. So we had an opportunity to talk with some of them, and then ended up at Tech Ops Specialty Vehicles in Queen Anne's County to see some of the federal projects that they're working on. So good day. Highlighting some of the cool things on the shore. So once again, congressionally directed spending portal is open. So local governments, and nonprofits that are on here, but local governments that are interested in talking, Alyssa and I are having those calls together. Right now we have the 22nd and the 26th dates that we're filling for meetings. If anyone has questions, please reach out. Thanks. Is that fast?
Thank you. Thank you. Absolutely. Alyssa Hastings.
Thank you, Mr. Chair. Good morning, everyone. Not too much of an update this morning. Similar to Kim, just wanted to echo, happy to talk through anyone's application. We're setting up these 30-minute calls. We can look further into other dates as well. And thank you all for your time.
I'm looking to see if Andy Harris's office is being represented today. And of course, my screen is like Brady Bunch. I only have so many faces here right now. So, yeah. Mike Detmer, I think I hear that Mike Detmer's on.
Yes, Mr. Chair. Thank you. No updates at this time.
Okay, very good. Members, we'll open it up for discussion and then adjournment. At the beginning, we did have a conversation about the treasurer's report. Is there any feedback, or we'll just update you next week? Everybody okay with that? Sounds so. Okay. Anything for the good of the order before we adjourn?
Don't forget it's Chicken Day.
It absolutely is Chicken Day. Absolutely.
Motion to adjourn, Mr. Chair.
Okay. Grab a second for that.
Second.
Okay. Have a good day, everyone.
So.